Hi there, welcome to my channel. I am Nurse Master Charlie, and on my channel I talk about nursing, health, education, and music. Today's topic is on how much do nurses make. If you are a student nurse and currently in school, I'm going to show you or talk about how much you can anticipate to make in your first year as far as a new nurse, your salary. Also, for the nurses who are experienced, I'm going to show you you can compare how much nurses make across the United States also. And for those of you who are thinking about becoming a nurse, well, this is going to give you some information, a little bit about what nurses do and then how much they get paid for doing what they do. Please be sure to subscribe, like, and click on the notification bell so that you can be notified when I make new videos. How much do nurses make? How much money do nurses make? That's always a big question. And then I'm going to talk about the different types of nurses, 6 different types of nurses, and how much they make. Also, where to live to make the most. So first off, I'd like to say, nursing is not about the money. Nursing is about caring for people. Nursing is about a profession of educated people who use their compassion, their passion, their intelligence, and their hearts, and they put this all together to care for people in their most vulnerable time of need, when they're sick, usually in the hospital. Contrary to what people believe, nursing, it is a job. You just don't go to work, sit at a desk, chart, and kick your feet up, and then get paid. There's a lot involved in being a nurse. Sometimes TV portrays nursing as being a very glamorous job. There's really not a whole lot of glamour in nursing. There is not any type of celebrity status. People aren't coming up to you asking you for your autograph. It is a job, it is a profession, it is very demanding. It is demanding physically, it is demanding intellectually, it is demanding emotionally. There's all these little components that go into being a nurse. Now, sometimes, or most of the time, nursing is about dealing with life and death. Whether it's a newborn baby being born or a patient who is taking their last breaths. That is all part of what is involved with nursing. It's also about giving life-changing or dangerous medications, inserting needles, taking out needles, tubes, all kinds of things that we do to the body. We're taking sometimes abuses, verbal abuse we'll say, from patients who are yelling at you, get out of my room. We're dealing with the family dynamics. Sometimes you have family members who don't get along with other family members. Now, we're there as a healthcare provider, not as an intercessor, but we also sometimes take on that role. We also have to keep up with hospital policies, professional scopes of practice. We have to maintain basically our education to keep up our licensure to be a nurse. Sometimes it also involves holding a patient's hand, whether they're afraid or they're alone. And sometimes it's also taking a family member aside and explaining things to them on their level and giving them the truth about what's going on as far as the disease process to make them better understand. So that's just a small glimpse about what nurses do behind the scenes. And now I've been a nurse for over 17 years, and I've seen a lot of behind the scene things, we want to call it that. So back to the money thing. So some people ask, well, why do nurses make so much? All they do is sit down and chart and give a pill here or there. Well, that's actually not all we do, but that's a topic for another video. Now, nurses don't make so much. They are compensated well for what they do. And the compensation depends on the type of nurse, where you live, and also sometimes what specialty and what degree you have as a nurse. So let's get started on the salaries of nurses. But just remember one thing, you can't put a price on a life. Now, where I got my information for these salary amounts is from the Bureau of Labor Statistics. And you can go and look it up yourself. This year is 2020, so I just typed in the Bureau of Labor Statistics and went in there looking at what type of salaries nurses make. Now, these are averages. Some nurses could make less, some nurses could make more, depending on, of course, their experience and of where they live. So let's start off with the LVN or the LPN, which is a licensed vocational nurse or a licensed practical nurse. These nurses are making about $48,500 on average. So some nurses could make a little less, some could make a little more, so always keep that in mind. Now, a registered nurse, a general registered nurse, an average yearly salary is about $77,460. So a little bit of a climb from the LVN or LPN, and a little bit also higher of a degree. An RN can have an associate degree or a bachelor's degree or even a master's degree or a doctorate degree. Next we have nursing instructors. These are the nurses who are teaching, whether they're going to be for example, an LVN, an RN. They're the ones teaching and molding their minds. They make generally, on average, about $83,160 per year. Next we have certified nurse midwives or nurse midwives. These are the nurses that actually deliver babies, kind of like a OB/GYN doctor. Their licensure takes them, gives them the ability to deliver babies in the hospital setting or in the home setting also. These nurses bring in about $108,810, so almost $109,000 per year on average. Next is nurse practitioners. These nurses work in a variety of settings. They can work in a hospital setting in the ER. They can work as a pediatric nurse practitioner, a geriatric nurse practitioner. They can work in clinics. Then, like I said, they can work in hospitals. They're going to be bringing in about $111,000 per year, almost $112,000. And topping our list is the nurse anesthetist. These nurses are responsible for sedation of patients during surgeries, and they're going to be bringing in about $181,000 per year. Granted, they have a doctoral degree. I think nowadays it's a doctoral degree, so they've gone to school a little bit longer. They're usually highly skilled in intubations, which is putting the tubes down the patient's throat so they can breathe. They maintain their sedation, maintain their pain control so they don't wake up in the middle of a surgery. So there you have the 6 different types, from the LVN starting at $48,000 all the way up to a nurse anesthetist making about $181,000. Of course, this is on average. Now, salaries are going to vary significantly. One of the lowest paying salaries, it is actually not in the continental United States, is Puerto Rico. These nurses are making about $35,000 per year. Whoa. So they need to up their salary out there in Puerto Rico. Arizona and Kentucky, you can kind of make between $60,000 to $63,000 per year. Now, somewhere like Michigan and Wisconsin, you're going to be making between $71,000 to $72,000. And of course, again, this is on average. You want to live out in the cold in Alaska, you can expect to make about $90,000 per year on average as a nurse. Now, in Washington, D.C., those nurses are making about $94,000 per year. Not technically a state, but it is in the United States, the District of Columbia. So that's pretty darn good salary in Washington, D.C. The second highest paying state on average is Hawaii. Those nurses are bringing in about $104,000 per year as a nurse. Now, topping all of the United States salaries, the nurses who live in California. These nurses on average are making about $113,000 per year. However, California does pay a little bit better than most states, but the cost of living is extremely high. Of course, depending on where you live, whether you're living in the San Francisco Bay Area, the Los Angeles area, or even down in the San Diego area. The closer you get to the ocean, the more expensive life becomes, and the salaries do go up accordingly. However, you could be making more, but you're going to be paying more to live. So there you have what nurses make, generally, of course, on average, across the United States, the different types of nurses and what they make, and which state pays the most. So thank you for watching. If you want to know more about nursing, health, education, and music, please be sure to subscribe, like this video, and click on the bell icon so you can be notified of when I put out new videos. And until the next video, bye-bye.